Hello, this is Dr. Amit Karkare, and welcome to this session of Guess the Remedy. This is an acute case of dry cough which came to me in around end of May. So that was the lockdown and typical COVID-19 peak period. She's a 60-year-old lady. She complained of dry cough which was going on for last 10 days. She's a very particular lady, so she already had gone to PMC clinic and she tested herself for COVID, which was negative. So she called me and she said that she has a dry cough and send me some medicine. My son will come to your clinic and he will collect it because she didn't want to step outside her house. I told her that okay, but are there any modalities? So I asked about all the possible modalities that we can think about, and she denied all of them. She said no, there are no other symptoms. It's only the dry cough, and just send me something for that. So there are two things that to learn from this case. One is the remedy, and the other is the practical tip that now I have realized and I have been using after 20 years. Is you if you ask for a characteristic symptom and they don't get it, you need to demand for it. So now I told her that okay, I will be sending you medicine. I sent her placebo, but I told her that I will be sending you some medicine, which is a very generic medicine for dry cough, but I'm not sure whether that will help. If you want to get better with homeopathy within few hours or within a day, then you have to give me some characteristic symptom. She agreed to that. She called me after 2 days and she told me that the cough is slightly better, 10-20%, but what she has observed is the character of cough, which is almost like coughing in an empty vessel. And the other modality was the cough is definitely gets triggered whenever she reads her pothi in the morning. Pothi is a religious scripture. So whenever she reads her pothi in the morning aloud during her puja, that's the time when the cough gets triggered and she gets really irritated. So now we have got some characteristic symptoms. Now you have to prescribe based on these symptoms and guess the remedy. So all the best for guessing the remedy, and do use this practical tip during case taking that if you don't get characteristic symptom, then demand for it because I just the way I told her that if you are coming to homeopathy, then we'll have to follow all the rules of homeopathy, and the rules are you cannot prescribe on common symptoms, you have to prescribe on characteristic symptoms. So you as a patient also will have to give me something characteristic if you want a good result for homeopathy. All the best for your efforts, and we'll meet after a few days with the answer to this case. Thank you.